The House Ways and Means Committee is scheduled to hold a hearing on Medicare for All, marking the first time that the proposal is considered by a committee with jurisdiction over healthcare issues.
So the House version of the bill has 110 Democratic co-sponsors. The Senate version, introduced by presidential candidate Senator Bernie Sanders, is backed by 14 senators. Here to discuss some of the challenges that policymakers could face when it comes to Medicare is the president and CEO of the Better Medicare Alliance, Allyson Schwartz. She is also a former member of Congress, having represented Pennsylvania in the House for 10 years. Great to see you.
All right, good to be here.
So, Congressman, lay out for us, do you see as the 5 biggest challenges in Medicare today?
Yeah. Well, there are a few, of course. And one of them is the increasing number of people turning 65 every day, 10,000 new seniors. This country, we're going to double the number of seniors in the next 20 years. So just the sheer number of seniors, we're moving from 12% of the population being over 65 to 20% of the population. So that's going to have ramifications in every which way in our society,
sure.
But certainly for healthcare, and also put certain demands on Medicare. So that's one, just preparing for those numbers. Mm-hmm. And two, of course, is really the changing health status for seniors. Think of younger, we're healthier, but the fact is that Medicare needs have changed dramatically over the last 50 years. Went from, we really worried about serious episodes of care, you needed surgery, you needed to go into the hospital, to the fact that really what most seniors just are really dealing with and managing are chronic conditions, and sometimes multiple chronic conditions. Your diabetes, cardiac disease, COPD, hypertension, and they're medications, there are things you can do about this, obviously things you can do yourself, but that is really changing and should be changing Medicare. I can talk more about that. It should be changing Medicare to meet those needs that patients have of managing their chronic conditions and coordinating that care, really being able to address care over time. A population of people. And that's a big change from Medicare. It's not the way it was sort of set up. Mm-hmm. I would say the next is that the traditional Medicare system also is a sort of pay for services as you go, and rather than a more coordinated system of care. So it's confusing, it's fragmented, it's complex for people to manage, to navigate. You go to see specialists, you're not sure who to go to, you try 5 or 6 of them before you actually figure out the right one to go. There's not enough primary care and primary care providers. So I think that's the third challenge. In Medicare Advantage, which we'll talk about, is really addressing that need. Actually, the other two as well, but really addressing the needs of people with chronic conditions and really looking much more holistically at care for seniors, and also achieving some of the less wasteful interventions and really target the right interventions. And then I would say there is Medicare, as much as we all really appreciate and value the security of Medicare, it doesn't cover everything, and it doesn't cover all the costs. And that's a huge surprise for people who turn 65, they go, whoa, I have to pay for this? And I think the fact that we also know that people are not saving for retirement, they're not saving for healthcare costs either. And that's something we really ought to deal with. We want to prepare people and to really have them understand it. So I think I got to 4, but obviously the other I would say is this sort of social determinants of health, this piece that and this happens in Medicare Advantage, as you move from a fragmented system to one that's a more coordinated system for people, you do start to look at their broad needs. And some of that turns out to not be medical needs, but to be more social needs. Social supports. What's your home like? Is it safe? Do you have any family supports? Can you take care of yourself every day? Do you feed yourself? Do you have nutritional problems? Actually, do you have transportation to get to the doctor's office? Or do you wait till the end of the...
Right.
And to get really sick and call 911? And as in Medicare Advantage, when you start to look at the whole person and look at those needs, you say, wait a minute, if we're not taking care of some of these social determinants of health, we're not going to be able to get the kind of outcomes. So I would say the last one is really about quality. Are we getting the outcomes we ought to out of our healthcare system of Medicare? And should we be looking at models that are actually giving us greater value?
So, Congresswoman, the Republicans, and you've laid out these big challenges to Medicare, but Republicans and Democrats have such different approaches to both of these things. How do you go about actually getting a consensus about how to tackle these? Is it free market? Is it government intervention? How do you reconcile those two?
Oh, well, you're absolutely right that there is sort of these seems like competing or contrasting values. But the fact is that what we've been really good at in this country is to actually, and as policymakers, remember my time in Congress, my job was to figure out the right balance. Like, what's a well-regulated private system get us? That's really what we've done with healthcare, and we don't build on that. So it's not an either or. It's not, okay, make it all public or all private. The fact is it takes both sides. The private sector is quite nimble. They can actually, test out things. They can explore new interventions. They can sort of say, test things in a way. And they're more data-driven, they have some of that technology, they were interested in technology. All those things are pretty exciting in healthcare. But then we also want some government oversight. This is public dollars in Medicare. And if more public dollars go into the rest of healthcare, there should be accountability for quality, there should be accountability for cost. And so I think the balance is there. What's interesting about Medicare Advantage, for example, is that there's really strong bipartisan support for Medicare Advantage. A lot of that has to do with the popularity of Medicare Advantage. So it's about 35% and growing of beneficiaries are choosing, it's a voluntary choice, are choosing Medicare Advantage, a more coordinated system of care, and moving away from that fragmented traditional Medicare. And members of Congress notice it. When I go to see a member of Congress and they say, oh, you have 40% of your seniors actually are Medicare Advantage and like it. And they hear from providers as well that this is enabling providers to provide the kind of care they want to provide, not only for seniors, but actually for other patients as well. So there's even at this time of really keen partisanship, there's actually quite a bit of interest, maybe sometimes for different reasons, but interest in Medicare Advantage and support for Medicare Advantage. And I hope that grows and continues and helps to build the future.
So one of the things that your group really advocates for is value-based care. Talk to us, what does that mean? What is that, and how could it change Medicare?
It is one of those little slogans that use, but really quite meaningful in the healthcare sector. And it really is saying basically, instead of just paying for services rendered, we're really going to look at what is the most valuable service you can provide at the most cost-efficient way and that produces the best outcomes. So it's better care at better cost that produces the best outcome. That's how we define value-based care. And it really is holding providers accountable, engaging them. Some of them are now increasingly taking some financial risk for a population of patients, which makes them say, wait a minute, more primary care helps you keep you out of the hospital. Some home care, that keeps you out of the hospital. Maybe meals and nutrition, that keeps you out of the hospital.
Why isn't that happening now?
Well, it's not happening because those services are not covered under traditional Medicare. It's happening, however, and in fact Medicare Advantage is leading the way here. It's happening on Medicare Advantage because they get paid a lump sum to take care of people, and they're held accountable for outcomes. So when you're held accountable, not just for did you do that service or not, but did in fact people get better at the end, or did they actually stay out of the hospital? That's one way to measure it. Did they stay out of the ER? Were they able to stay home for longer? Did they go home sooner? Do I have fewer complications? You start to change the way you provide services and even the way you engage beneficiaries, engage patients, because patients have to take some real responsibility in this as well. And you have to say, look, if we're going to really do this together, how can we do that? And I say, look, I have no one who can help me at home. They might say, well, maybe it's worth sending an aide in once in a while, or should we go and check on the home and really see if there's some hazards? We've heard stories about people falling out of they have falls, and so not until you go to their home, they go, I don't know what's working. Turns out one man told me that they got a new bed and his bed was really high. These beds are really high now, and he fell out. Well, the third time it happened, someone said, what can we do? No one actually asked him that question. And it turns out they got him a hospital bed, and he hasn't had to fall out of bed since. So it sounds so simple when you say it, but no one was asking those questions before. And so that is, but it also wasn't ever paid for. And what's different about Medicare Advantage is you say, here's a lump sum, you've got to take care of these people. They're starting to ask those questions. They're starting to include social workers in their primary care teams. They're really doing home visits. And that additional ability, the capacity to do that, and accountability for outcomes, it's changing, it's really transforming the way healthcare is being provided, and I have to say it's really Medicare Advantage, and for seniors, it's leading the way on this.
So to that point, several experts say that one of the level setters for the future of Medicare is actually addressing the socioeconomic disparities within the system. Who gets care, what sort of care they get, when they get it. So is this a challenge or is it an opportunity for the future of Medicare?
Well, it's both, because one, it's not what clinical providers were used to really
Right.
dealing with. So one of the challenges is how can you incorporate that into what is traditional medical care in most of our country. So that is a challenge for providers to say, what questions do I have to ask? It's a little bit like pediatricians never used to ask, do you use a seatbelt or not, or the car seat for your kids? Now they do. They ask about safety in the home. Where do you keep things that could be poisons? I mean, to ask seniors, is your home safe? Is it not safe? Do you have and look other functional disabilities? Is there anyone who can help you buy groceries? And if there's not, how can we help make that happen? And they can build those community partnerships so that there are services in the broader community, but to really have them be less siloed, to have them actually start to work together on behalf of seniors, many of whom are living alone, a lot of social isolation. A lot of seniors say, I'm just fine, when they're really not so fine.
Yeah.
But they want to stay home. They want to stay in their home if they can. And so helping them be able to do that and helping them be able to eat right, to take their medications, even as not a simple thing is to get people to actually fill their medications. Well, if your pharmacy doesn't deliver and you can't get out of your home, you're not taking your medications.
Right.
Those are things that now we find under Medicare Advantage, they're asking those questions, they're following up. And there are people with more needs. So when you have somebody who has really complex clinical needs, 5 or 6 chronic conditions, and really they're 14% of people under Medicare have 6 or more multiple chronic conditions, and they're also costing us about half of what we spent on Medicare. So actually, some tailoring care to those people who really need it is going to save them their own costs, and to save also the system costs, and actually improve their well-being.
So obviously there's this debate, especially on the Democratic side, about Medicare for all. But putting that aside, are there other benefits that you think Congress is looking at adding to Medicare? Are there expansions outside of expanding the age range where Medicare would be available?
Well, they definitely are looking at, should we more people buy into Medicare? How can we expand a system that already exists to cover more people? And there are real questions. How people can afford it, whether they're going to have to pay, will they get subsidies the way they do in the exchanges, should we just do it under exchanges? I think all of those are good debates, because there still are people who are uninsured, there are people who are underinsured, and it still is, it's expensive. Even Medicare, it's not inexpensive. There are co-pays, there are deductibles. There's a lot of concern about prescription drug costs and being able to reduce prescription drug costs for everyone, but certainly for seniors under Part D, which you have to buy separately from your traditional Medicare. And so they should work on that. They should do that. And I think they should really, as they do this, really look at ways that we can hang on to this incredible transformation, which is not yet complete by any means, but a real transformation to building on a system that really looks more holistically at the kinds of services people need, and potentially learn from that to be able to add those benefits to traditional Medicare as well.
Very interesting stuff, Congresswoman Schwartz. Thank you so much.
Congresswoman.
Very good.
We'll have more on the future of Medicare throughout the week.
And there's more rising just after this.